and welcome. NCDC confirms 13 new COVID-19 cases in Nigeria as Kano State records its first case of the disease, just as Kaduna State government raises alarm over community transmission of COVID-19 after confirming its sixth case. President Buhari appeals to Nigerians to stay at home, saying restriction order will last as long as scientific advisors deem fit to halt and defeat the spread of coronavirus. Federal government shuts border to Cameroonian refugees as more states take more drastic measures to contain the spread of coronavirus in the country. And over 2,000 COVID-19 patients die in the United States, being its highest coronavirus death toll in a single day, as the total fatality in the country hits over 20,000. Plus, business, sports, and international stories.
On business news tonight, member countries of African Petroleum Producers Organization commit to support efforts by OPEC Plus in stabilizing the global oil market.
And on sports news tonight, Gabonese Football Federation president asks Arsenal captain Pierre-Emerick Aubameyang to leave for a more ambitious club.
The Minister of Health, Dr. Osage Ehanire, will be speaking to us about efforts at curbing the spread of COVID-19. But now, the total number of confirmed COVID-19 cases in Nigeria has risen to 318 after the Nigeria Center for Disease Control today announced 13 new cases in the country. 11 of the new cases are in Lagos, 1 in Delta, and 1 in Kano State, bringing the total number of COVID-19 confirmed cases in the country to 318. A breakdown of the cases in each of the states show that Lagos now has 174 cases, FCT Abuja 56, Osun 20, Edo has 12 cases, Oyo 11 cases, 7 in Ogun State, Bauchi and Kaduna have 6 cases each, Akwa Ibom 5, Katsina State has 4, while Enugu, Ekiti, Kwara, Rivers, and Ondo State each have 2 cases. Delta has 3 cases, and Benue, Niger, Anambra, and Kano record 1 case each. 70 people have been discharged and 10 deaths recorded. Meanwhile, the NCDC says 2 new labs have been activated for COVID-19 testing, 1 in Kano and another in Plateau State, bringing the total number to 11, while work is in progress for Maiduguri, Sokoto, Port Harcourt, and Kaduna State to have their own COVID-19 testing center. The president is asking Nigerians to remain at home while assuring them of more interventions to reduce the pain caused by the COVID-19 crisis. In a statement, President Muhammadu Buhari thanks all Nigerians for their patience, resolve, and strong determination to defeat the coronavirus outbreak. In his words, no elected government could ask more of citizens of the country that elected them than today we ask of you. But we must ask you once more to observe restrictions on movement where they are in place and follow the instructions of our scientists and medical advisors. Stay home, wash your hands, save lives. He notes that the stay-at-home order will only last as long as the scientific advisors say will be necessary to halt and defeat the spread of the virus, while regretting the fact that many would not be able to be with their loved ones at this period. He also promises to ensure that those who suffer most as a result of the restriction are assisted with both federal and state government palliatives. In Kano State, the governor, Abdullahi Ganduje, says that businesses would no longer be as it will no longer be business as usual concerning social distancing and all other measures against the spread of COVID-19. He was speaking after Kano recorded its first case of coronavirus. The patient was said to have been diagnosed with the virus at the COVID-19 lab test center at the Aminu Kano Teaching Hospital. He has, however, been moved to the isolation center in Kwanan Dawaki, also in Kano State. The state government recently inaugurated a 500-bed isolation center at the Sani Abacha Stadium in Kano in residence for any confirmed cases of COVID-19 in the state. Let's head south to Anambra State, where Governor Willie Obiano has ordered a total lockdown of the state, which recorded its index case of COVID-19 on Friday, directing security operatives to arrest violators of the new order where necessary. Governor Obiano gave the directive today during a broadcast on the new development. He confirmed that the index case came in from Lagos and has been placed in one of the state's protective care centers.
As the country grapples with the gradual spread of the coronavirus pandemic, a number of states have issued the stay-at-home order to curtail its spread. In Anambra State, the governor has issued a fresh order for a total lockdown following the confirmation of a first case of COVID-19 in the state.
The restriction of movement is hereby extended by another 2 weeks. This time around, we are placing a comprehensive lockdown on Anambra State. We shall not tolerate any movement across the state by individuals and groups. Only people on essential services are permitted to move around in the delivery of those services to the people.
With the fresh order coming on an Easter weekend, ensuring compliance is going to be a huge task. It's business as usual at the bridgehead axis of Onitsha. A perfect example of low compliance to the directives, security agencies then turn some motorists back. Distracted, those on foot walk free. Earlier in the week, the state government provided palliatives to cushion the effect of the order on residents. But commercial motorcycle operators and traders insist on going about their daily businesses.
I had to come out like this and find something for my children to eat, and I too, and also my house rent. And precisely, my keke napep is a high purchase. I haven't finished it.
They should provide for us first before we go home and stay.
It's a worrisome situation for some governors' aides.
The Amoka border between Anambra and Imo State, there are great challenges there.
What is worrisome, it's not just about the traffic, it's the movement of the people itself. People come from Asaba end are dropped and they walk across and join vehicles into Anambra State. The same way people from Anambra State walk across the bridge and join vehicles to Asaba.
With an index case now reported in the state, the government expects that the stay-at-home order will improve to stop further spread.
Let's get further insight into the COVID-19 pandemic and how the government hopes to contain the spread of the disease in the country. We're now being joined live from our Abuja studios by the Minister of Health, Dr. Osagie Ehanire. A pleasure having you with us.
Thank you. Good evening.
Now, we now have 318 cases, 70 discharged, but 10 deaths. Do we have cause to worry?
Well, at the moment, no, not much cause for worry. Let us say the rate of increase is a very slow incline, and a lot of it is very likely to be the backlog of cases that have been traced, and about 91% of the contacts have been traced. So the findings cause an initial increase in the number of cases that we have, and there's still room to watch and see.
Now, people seem to not have taken the lockdown seriously in places like Lagos and Abuja. We've seen quite a few defaulters. People say it's a hoax. So do you have any plans to ensure that this message sinks in?
We have to increase our messaging. We have to also speak a lot with community leaders and religious leaders and the gatekeepers of society to understand the importance and the gravity of this disease. It is a disease that spreads extremely easily, extremely rapidly, and we have to continue to urge communities to not to congregate, to wash their hands thoroughly, to observe social distancing, and to take all those measures that have been advised in government, because the price of not taking these measures is very high indeed. So the leaders of communities should really take it seriously to advise their wards, and parents should advise their children that these injunctions from government are extremely important and should be taken should not be taken lightheartedly.
Dr. Aimee, what role is the National Orientation Agency playing in this regard to ensure that the message really drives home?
Well, the National Orientation Agency is involving speaking to the public in the way that they usually do, through jingles, through public messaging, and giving messages as poignantly as possible so that it sinks in. Unfortunately, there are some people who tend to trivialize all of this because they haven't seen the effects. But those who have seen what is happening in other countries, particularly in Europe and the Americas now, will have a fear and know that if we act quickly and make a sacrifice now, we shall be able to avoid a lot of pain later on. So the message needs to be driven home, not only by National Orientation Agency, but by all other agencies and by all persons and those who have the ears of the people.
Now let's look at the issue of the Chinese doctors. They picked where they will self-isolate, but if the reverse was the case, this can't happen in China. Can you tell us more about the arrangement and their isolation so far?
Well, what we know is that before they arrive, we give them the message that in our country, when you come in from outside, particularly from a high-burden country, you will isolate for 14 days. And we also asked the Nigeria Center for Disease Control to go and look at the isolation center even before they arrived. So that was done. And by the time they arrived, the message was also given that they had to isolate for 14 days. And that the NCDC will have the liberty to check on them randomly to see that they are actually observing the self-isolation. But I must also say that the authorities told me that every single one of those who came had a pre-boarding check, and they were all said to be negative. Nevertheless, we did tell them that our regulations require that they comply with the 14-day isolation.
But why were they allowed to pick where they will isolate?
Say that again, please.
Why were they allowed to choose where they will be isolated for those 14 days?
Oh, okay, because they have, yes, our understanding, they have a large compound, they have a facility, a medical facility. Remember that this is a giant construction company. They have been in Nigeria for 39 years, and they have a lot of facilities in their compound. They told us that they have the ability to carry out this self-isolation. And we do allow self-isolation provided it has been inspected, and that is why we asked the NCDC to go and carry out this inspection prior to the arrival of the crew.
Honorable Minister, you applauded Nigerian doctors for doing well in handling this crisis. So why bring in the Chinese doctors at this time?
Well, in the first place, we didn't bring them in. I think the company, in its own wisdom and probably in its own corporate responsibility, social responsibility, thought they should bring people to come and help us and advise. We didn't issue any invitation. But we are not unhappy that they're here because we can learn from their experience. These people have been through it. We want to start with a video conferencing with them even while they are in isolation so that we can try to learn from their experiences. There is nothing better than learning from someone who has actually suffered an event and been inflicted with an injury. So there are people there who are specialized doctors and nurses, and what we can learn from them, we learn. But I think the company in its own wisdom thought that we will benefit from this kind of initiative. We didn't really ask for it or say, bring us this. In fact, we didn't know that this whole gift was coming from the company. We appreciate it nevertheless.
Finally, Dr. Ehanire, what lessons have you learned from this pandemic vis-a-vis our healthcare system?
Tremendous lessons. The first lesson is that there is almost no healthcare system that is ready. You can see in review on television that a lot of health systems which are regarded as robust and almost invincible collapsed under the weight of the outbreak, and which has really shocked people, shocked everybody around the world. We have seen how in very advanced countries, patients had to lie on the floor because there were no more beds. They ran out of beds, ran out of ventilators, ran out of even simple things as masks. So the lesson is that one should be prepared. We should have stockpiles, and that is why even now we are very happy to have stockpiles. We want to continue to increase our stockpiles. We are grateful for what we got from donors, from everybody else, and we are getting another consignment from the United Nations very soon. The EU has also promised us something. We know that it's difficult to get commodities now. Even masks and ventilators are very hard to come by, and even if you place an order now, you have to wait a very long time. And because we do not know the magnitude of this outbreak, we put a lot of value on having a good stockpile of things that we shall require, including ventilators. We are getting 50 ventilators from the World Health Organization, and 35 ventilators are among the consignment that came from China a couple of days ago. So this addition of brand new machines will help us a lot. I'm doing an inventory of the intensive care specialists we have in the country to make sure that every state gets an intensive care specialist, a critical care specialist who will be able to use these ventilators. And I think about 4 or 5 states do not have an intensive care specialist. We shall see about deploying intensive care specialists to those states to be more ready to handle cases that crop up.
Minister of Health, Dr. Osagie Ehanire, it's a pleasure having you with us on the News at 10.